Hi, I'm Dr. Giavonne Rondo, host of Healthy Mind, Body, and Spirit. And this is our second season. And we are focused on improving the wellness of our entire world, but with a particular focus on the African American community here in the local Kentuckiana area. And right now I am in the West End, the best end, at Park DuValle Community Health Center. This facility is an amazing facility that is right in the heart of West Louisville. And it is an absolute gem right here. And I actually work here part-time. And so there's some people that I would like for you to meet in Park DuValle and also talk about Park DuValle and all the different features that Park DuValle actually has to offer.
Hi, I'm Elizabeth Ann Hagan-Grigsby, but everyone here in Kentucky calls me Ann, and I am so blessed to have the opportunity to be the Chief Executive Officer here at Park DuValle Community Health Center. It's an amazing opportunity that life and God has afforded me and allows me to do things in the community and to help people and work with people that I ordinarily would never get to meet. This is an absolute blessing for me and the community as well.
Awesome, awesome. So I have known about Park DuValle probably most of my life, but I still think that a lot of people may not know what Park DuValle is and exactly where it's located. So can you kind of give us a little bit of an idea?
Sure. Park DuValle Community Health Center is the oldest federally qualified health center in the Commonwealth of Kentucky. We started back in February of 1968.
Wow,
So
1968, that's a good year.
It's a good year.
Yeah.
And so it was started by Dr. Harvey Sloan, who was also a former mayor of Louisville later on in life.
Okay.
So
he was both in the medical field and the political arena.
yes, he started out in the medical field as a physician in Appalachia, and then he was in Vietnam. When he came into Kentucky, he said Kentucky needs a health center like the ones he heard about that are these federally qualified health centers. So he actually went to Washington, D.C. to advocate for a health center like that in Kentucky. And he was able to get this one started here in Louisville, Kentucky. And they opened, I believe it was February 3rd of 1968.
Okay,
And
wow.
I might actually have something here. People don't know this. Park DuValle started the first ambulance service for the city of Louisville. There was no
Here at Park DuValle?
Yeah, there was no public ambulance service. So we had an old building down the street off of 34th Street, and it was part of Carter Homes, and people had given up their apartments to allow them to have a health facility right here in the west end of Louisville. And then we realized people were getting down to Old General Hospital in taxi cabs and in police cars and in friends' cars. And so Park DuValle started the Park DuValle Neighborhood Health Center ambulance service, had their own ambulances, EMTs, and then the city took that over. And later it became the Metro Louisville EMS.
Wow. So right here in West End, the West End, the best end, this is where the ambulance service started, was right here. So
Yes.
That is just absolutely amazing. And that's a part of history that I never knew about. I was born and raised here in West Louisville, and I never knew that.
Yeah,
So that's amazing.
It was the Park DuValle Health Center then and now always trying to meet the needs of the community. You know, what do people need and figure out how to get it to them.
Okay.
And we're over here now on Wilson Avenue, at 3015 Wilson Avenue, in this new facility. It's been here, it's relatively new. It's been here since 2002.
So this is a pretty large building, and you all moved in here in 2002, but there's some other buildings that are around the city, am I correct?
Oh, yes.
Other Park DuValle. So Park DuValle is here, but then Tell us about some of the other
Okay,
facilities.
this is our main administrative site, so it's pretty big. It's about 43,000 square feet of space. But then we have smaller clinics that people may not know are Park DuValle Health Center affiliated satellite clinics. Like there's one at 1425 West Broadway. That one's called the Russell Neighborhood Health Center.
Okay,
It's
okay.
directly across from the Fifth Third Bank and down the street from the Republic Bank YMCA building. And
Really close to the Urban League.
it's down the street from the Urban League too, a few blocks down from the Urban League. Okay?
Are there other satellite
Yeah.
offices as
Yeah.
well? Let's see, Henry County?
There's one in Henry County. It's out on 75 Park Road in Newcastle, Kentucky. That one's co-located in a beautiful building that was, I think it opened in 2009, was where the building opened belonging to the health department. But we just moved in there last year. And it's the Henry County Community Health Center. There is no other federally qualified health center in that whole county.
Oh,
There is no
wow.
hospital in that county,
In Henry County?
in Henry County.
Oh, wow.
And we also have another one in Taylorsville in Spencer County. That one had been there since 1985, but the building was really tiny, like 4 exam rooms.
Okay, okay.
And so now we have this big, beautiful 10,000 square foot building directly across from the Spencer County High School.
Okay, okay.
And there's no hospital in that county either.
Wow, wow. So there's just so much going on. And so right now we're here in your office. It's kind of like the behind the scenes
Mhm.
location and or within Park DuValle here on Wilson Avenue. And this is a huge, like you said, 40,000 square foot facility. So what we're going to do is actually go around and see some of the great offerings and features that Park DuValle actually has. Because it sounds like there's a lot, I know that there's a lot going on, but I want our audience actually to see all the things that are going on.
And we want to share the good things we're doing.
Yes.
And I forgot to mention, we do have 2 clinics in schools too.
Oh, okay.
We have a
Okay.
clinic in Central High School.
Okay.
And
Wow, a clinic in Central High School.
It's for
And-
Central High School students and staff and faculty. And we have a clinic in Pleasant Ridge Park High School for students
Wow.
and staff and faculty.
Okay, okay.
And so,
Park DuValle really is, all over.
oh, and we have a mobile dental van. Okay, I'm just gonna pop collar here. We have a mobile dental van too.
A mobile dental van.
That's brand new for us, but we didn't want Kentucky to have the reputation of being the toothless society, because we can make services available and affordable to people
Yes.
and get to them wherever they are. So
Yes.
the mobile dental van dentist is like a mobile dental office on wheels,
Uh-huh.
and it has x-ray and everything right there in the mobile van.
Wow. That is amazing. That's
UV light for killing germs.
It's
It's
you got some
wonderful.
good things going on. So we
Amazing.
want to know more and more about that. I'm a big advocate of mobile units. I'm definitely a big advocate of that. So we definitely want to maybe take a peek at that unit if
Yes.
we possibly can, or just at least, see a little bit of that.
Mobile units are the wave of the future. I mean, there are a couple of different Care Mobile, does dental,
Yes.
Go Mobile, does medical.
Yes.
It's just wonderful ways to make sure that people have access when they need it, where
Yes.
they need it.
Right, going for where the healthcare really is.
Yes.
So yes, so
Yes.
stay tuned. We're going to actually take a look around this wonderful facility and some of the other people who work here. Stay tuned.
The insurance enrollment is so important, because even though Park DuValle Community Health Center serves patients regardless whether they're insured or not, or documented or not, any race or creed or ethnicity and economic level, it doesn't matter. But if you need to have surgery or need to go to a doctor's office that's a specialist, you really need insurance to do that. So what we have is an outreach and enrollment team that can help you determine if you're eligible for Medicare, Medicaid, or get a qualified health plan that'll fit your budget. So if there's something that we cannot take care of in our primary care clinics, then we can find a specialist or get you to the hospital to get you the care you need at the time you need it.
Okay, so someone does not have to necessarily have insurance, but you can actually explore insurance options here on the second floor of Park DuValle.
Yes. You do not have to have insurance to be a patient here, but if you want to find out about getting insurance or getting Medicaid, then we have certified application counselors who can assist you. And they're located here at our Wilson Avenue office on the second floor.
Okay, and there's other things. Speaking of second floor, there's other options here at Park DuValle that's just right across the way. Can you show us?
Oh, sure. Let's walk right across the hall. There are doors to lots of amazing things.
Oh, okay.
We have right here, this office says, please register at the registration desk on the first floor before entering. But this is WIC. This is nutrition. Most people heard of WIC offices, women, infants, and children, but you can get assistance with food if your children are age 6 and under, and they're open right here, and they will get you signed up for WIC if you're eligible, so you can make sure that you get the food that you need for your young children. And that's really important because, you know, having good nutrition at any age is important, but it's especially important for babies and young children who are still growing and developing. And so WIC can make sure that you have what you need to eat at home.
Okay.
We have other programs, though, too, that are for grown-ups for food insecurity related issues.
Okay.
We happen to have a Humana Foundation grant where if you are insured or uninsured, but you have food insecurity, that means you don't have enough food to eat, and you want to enroll in that program with us, participating in the program, you can get like Kroger cards or cards to use at a grocery store to buy healthy foods for you and your family. So we want to make sure that people of all ages get appropriate nutrition.
Okay, and that's so vitally important. I know as myself as a primary care physician, nutrition is probably, if not the most important thing that people can do to help with their overall health. So this is just a great program. Thank you so much. And we're gonna be heading on down the hallway to more of the options that Park DuValle has.
If you look at these right here, we're passing by some murals on our walls. These are actual murals done that were taken from photographs of patients and staff in the center. Years ago, G.C. Cox, Gloucester Callum Cox, was one of our patients for years. He's deceased now, but he's a world-renowned Louisville artist. His works hang in the Smithsonian. All the people in these were former physicians or nurse practitioners or nurses who worked here at Park DuValle.
Wow.
There's one that's right in front of us that shows a lady that's looks like she's obviously pregnant, and her adult daughter would come here sometimes and say, "That's me when I was in my mommy's belly." So,
wow. So these are real people.
Real people. These are photographs of real people who used to work here and who were patients here at Park DuValle. We've had behavioral health here at Park DuValle since 2012. That was the second iteration though, because we used to have behavioral health in the old building back on 1817 South 34th Street, before 7 counties existed. We had our own psychiatrist there. One of the psychiatrists who may still be at 7 counties out of Chapman was our psychiatrist at Park DuValle in the early days. But once 7 counties started, we didn't want to duplicate services, so then 7 counties was doing behavioral health, and then we stopped. But we found that there are so many patients that we have who are uninsured. In many cases, it's almost up to 30%, who found it hard to get the behavioral health services they needed. So we decided to bring behavioral health in-house. We do still collaborate with other offices, but we have psychiatric mental health nurse practitioners, we have licensed clinical social workers, we have behavioral health technicians, we have this beautiful facility here for behavioral health. We have, we don't prescribe controlled substances, but we do have ways that we can work with patients regardless of what their behavioral health issues are, or refer them on if they need additional more robust interventions. We do also have a collaborative with University of Louisville Department of Psychiatry, so psychiatric residents come here as well.
Good. It just sounds like there's just a huge psychiatric and mental health kind of fund or oasis here for our patients. So we're so glad that this is here and that this facility not only exists, but exists in such a full capacity.
And we do behavioral health here, not only face to face, because there are all these offices where our clinical providers have their own private offices, but we also do telehealth too.
Oh, okay.
So, you know, if the patient, especially during this COVID pandemic, the patient needs to be at home and talk to a behavioral health provider, we can arrange an appointment like that for them.
Okay. So here at Park DuValle, they also do telehealth, telemedicine, or virtual visits. So to just allow people who may not be able to actually come into the facility to still be so-called seen and still be heard and still be taken care of in a safe way.
Right. And if we've never seen you before, though, say it's a medical visit, we would like you at least to come in and see a doctor or a nurse practitioner, but if it's for something that, you're an existing patient and you just need to do a telephone or video visit, we can arrange that. And then if you can't get here to pick up your medications, we'll talk about that a little later, though, it's we can arrange that too.
Because there's a pharmacy downstairs.
Yeah. Park DuValle Community Health Center has a federally funded 340B pharmacy. That's a special pharmacy that's only available to federally qualified health centers like us. And that means that we can give you medications at significantly discounted prices. We believe that if you're a patient and you go see your doctor, your nurse practitioner, your dentist even, but then you can't afford your medications, then you cannot be compliant and you cannot get healthy and you cannot stay well. So a 340B pharmacy like ours allows you to get your medications. We make them affordable. If you can't afford them, we work out how you can pay it in multiple payments. We have a pharmacy delivery van, so we try to gear that towards senior citizens. So if you can't come out or you're afraid to come out during the COVID pandemic especially, we'll bring your medications to your home. And that way you don't have to come someplace where it may make you a little nervous. But we're glad to be able to get them to you because we want you to stay well. We want you to get well. This is a wonderful resource. We have pharmacists, we have PharmDs, we have pharmacy technicians. We're state licensed like any other pharmacy, but we're not a retail pharmacy. So if you're a doctor from some other practice, you can't get your medications from us, your patients can't. But if you're a Park DuValle patient at any one of our 8 locations, any of our doctors or nurse practitioners or dentists can write your prescription, if they have a DEA license, of course, and then you can get them here at our pharmacies, probably at a deep, deep, deep discount compared to what you might have to pay if you went to a retail pharmacy.
Wow. So this is in the middle of the west end of Louisville. A pharmacy right here at Park DuValle. It has it all, and this is a true gem of a location. And right now we're sitting in the adult reception area, the adult medical reception area. Park DuValle services adults, and in that adult sphere or specter, we also service women's health and also children or pediatrics. So we have different levels or different sections. Also, Park DuValle has both an X-ray and then laboratory. So they just offer all different types of care, and that's as comprehensive and as holistic as we possibly can be here at Park DuValle.
Adult Medical Clinic is a place where anyone age 19 and up can come in and get the highest quality health care of many places in the world. People don't know that Park DuValle Community Health Center is a national health quality leader. So we're in the top 2% of federally qualified health centers in the United States and all of the U.S. territories. We're also a diabetes leader, and we're also a health center quality leader. So not only do you get wonderful people with smiling faces and open hearts, but you also get high quality of care.
Yeah, you can't see it behind the mask, but everyone is smiling.
Yes, I'm smiling under this mask too.
Yes.
So.
And we are now in the pediatric portion of Park DuValle, and yes, Park DuValle sees kids, sees lots and lots of children. Do you want to go ahead and talk about that?
Yes. We see children of all ages here at Park DuValle. We have a women's health department, so we have OBGYNs, so we have new babies being born. Okay. But then we also have young people all the way up through age 18 who can come to the pediatrics department, and we provide vaccines for children, whether you're insured or not. We want to make sure that every child is healthy.
Yes.
We want to make sure that every child has a good start. So.
Yes. And vaccines help tremendously. Yes. There were a lot of diseases or issues that may have occurred before the vaccines, like way back in the day. Polio was something that was prevalent. We don't even hear about polio anymore. When I was a child, I remember having the chicken pox. Mm-hmm. But children nowadays, because of the vaccines that we have, don't have to worry about that. Right. So vaccines are very, very important.
Vaccines are very important to keep your child healthy, to keep from infecting other people, to make sure that all the children in your child's school are safe and healthy.
Yes.
And so, we want to make sure that every child is age appropriately vaccinated.
Yes.
And then there's some special vaccinations that are important for teenagers to get as well,
yes.
because there's some that can protect you from like HPV.
For the human papillomavirus.
That's it.
Yes. And that protects you eventually against certain types of cancers, particularly cervical cancer and potentially anal cancer, and also throat cancer as well.
So it's important to get vaccinated at all ages. And so when we talk about vaccinations here for children, it's important, but the parents need to be vaccinated too.
Yes.
Or you need to get your you can get your annual flu shots. You can get pneumonia shots here. And you can get COVID vaccine here, too. That's really important to get everybody vaccinated against COVID-19 so that we can stop the epidemic in its tracks.
Yes.
And we can do that if we all work together.
Yes. And together we can be better. Mm-hmm. And we have to particularly remember for our community, the African American community, we're being hit harder. Mm-hmm. And so we have got to do the things that protect us. Not only wearing the mask, not only washing our hands and staying, physically distant, but still socially connected, but also the vaccinations are vital. They're really vital. Now, vaccines are probably not going to be for the children just yet for COVID-19, but they're really important for the adults, particularly the older adults, 60 and above. Now, we have to remember that we tend to think of protection for kids, but actually with this vaccine or with the COVID-19, we have to protect our adults and our more seasoned population.
Seasoned, I'm protected.
Yes.
I've already had my vaccine. I'm so excited. I can't see straight, and I can't wait for everybody who can get it to be able to get it. So I'm hoping that's happening.
So that's vitally important. So we're going to go back to the pediatrics, and since we're here, and talk more about what goes on here, but also at some of you have school-based pediatric.
Yes, we do. We have here in this clinic we have physicians and pediatric nurse practitioners who can see any child up to age 18. But we also have school-based health centers. One is at Central High School down on Chestnut Street, and then one is at Pleasure Ridge Park High School on Greenwood Road. And at those sites, we can see any of the students in either of the schools, but we can also see the faculty and staff who work there. So we want to keep everyone healthy, not just the children who go to school, but the people who teach them every day and the people who work in the buildings where they are being taught.
Yes, that is so very important. So also taking care of the other workers, essential, the teachers, the administrators, principals or whatnot.
Yes.
And so, awesome. That's an awesome thing that
and it's wonderful for them because you don't have to leave and go somewhere to see a doctor. You can go see the nurse. We have a nurse practitioner there. We can go and see the nurse practitioner right there in the building where you are. Awesome. And if someone gets sick during the school day, they don't have to send them home. They have to call their parents and say, we need to take them to the clinic in the building, and they can take them to the clinic in the building.
Awesome. So this is another instance where healthcare is coming to you. You're not just going to, but so they're meeting people where they actually are.
Yes.
In the schools, at work for those people who work at the schools. So that's amazing. Well, thank you so much. This has been just an amazing journey through Park DuValle, at least this location. Again, Park DuValle has other satellite locations that are throughout the Kentuckiana area, but this is the largest, obviously. This is the main location. So this has been really wonderful to learn about all the different things that Park DuValle really has. It truly does have it all. Thank you again. And this has been a wonderful episode of Healthy Mind, Body, and Spirit.